I'm Dr. Geoffrey Mutuma. Today we are going to talk about infertility, and we touch a bit about libido. This is a problem which has been quite common, and infertility is something which is quite disturbing to people, especially family people who have no children. It looks that recently infertility is quite common, and it's a problem which are going to disturb a lot of people, and people look for a lot of consultations in several places, and they actually spend a lot of money. And it's good to know what is infertility, what is that we call infertility. Infertility is when a couple cannot be able to conceive, and we consider people to have or a couple or people are married to have infertility when they cannot conceive at least for 1 year. Less than 1 year, that one is not considered as infertility. And something of very important is that we cannot consider as infertility when the couple or the two people want to have a baby, they are living very far from each other. So infertility is considered as people are living together and have stayed together for 1 full year and they cannot be able to conceive. Now, there are two types of infertility. There's primary infertility and secondary infertility. Primary infertility is where mainly the lady has not conceived even at once. And then the secondary infertility is where somebody conceives the first child or the first baby, and then it's also almost impossible to be able to conceive and another day. And this depends a lot. You find that actually somebody can take 5 years, somebody can take even 10 years, the distance between or the space between the first delivery and the second delivery. And you find that there are so many people who have got one child and they don't actually conceive another child. That is called primary infertility, meaning that actually somebody conceived first or delivered first, but then after that it could not be able to conceive. And that is called secondary infertility. Now, infertility is normally considered to be both for man and for the woman. And most of the causes causes of infertility is actually comes from women. It is not that men cannot have cause of infertility, because most of the cases when we are investigating for infertility, we actually say that it's good for both the man and the woman to be screened first, to be checked what might be the cause of that infertility, because most of the times that infertility is actually for female, but men almost also contribute to the cases of infertility. Now, what is the common causes of infertility? The common cause of infertility actually it is a blocked tube, and this mainly comes from LLD. That's one of the causes of primary, even secondary infertility. The other one is when we have got hormonal imbalance. We find that the hormones of a lady, they are not balanced, so she cannot be able to conceive because she does not receive periods. And the other cause of infertility, especially in ladies, is when you have got fibroids or something which are distorting the uterus. So those are the main causes of infertility in women, while the causes of infertility in men is actually one, and that's the production of the sperms. Most men may not be able to produce enough sperm or sperms which are abnormal. So from that, when it's like that, some men actually, they don't produce sperms at all. We have got three different categories. We have got azoospermia, when the man cannot be able to produce any sperm at all. We have got oligospermia, when the man produces very few sperms which are not adequate to be able to fertilize. And the other one, abnormal sperms, where you find that either the sperms which man produces, they have no head, or they have no tail, or they have got two heads or two tails. So it becomes they're really abnormal. So and that's one normally what we check. So normally when a couple or individuals present with infertility, we normally do investigations, and that's what we check. We check if the tubes are blocked. We check if there's any fibroids, and we check if the amounts of validity they are normal. And if they're normal, now we focus on man and check if there's any problem. There are so many cases where you find that actually we investigate and find that both man and the woman, they are normal, but they're not conceiving. And normally what we normally tell them is that it's normally very important to make sure that at least when it's like that, you focus on actually timing when you can be able to conceive. Now, the reason why most people, especially for couples which stay very far from each other, you find that it is because a lady actually is supposed to produce ova, or a fertile period for the lady can be very short. So you find that if a man stays in Mombasa and a woman stays at home, or a woman stays in Doret and the man stays in Kisumu, the days when they can meet, it can be the unfertile period. And the fertile period for ladies is very, very short. Is mainly almost 72 hours. That's almost 3 days. So it means that if they don't meet within that day, the woman will not be able to conceive. And that's why when we consider or we talk about infertility, is that when we talk, we say that people are staying together and they're not conceiving. And that's why sometimes it's normally very important to make sure that at least before you start looking for babies, so before you start consulting the doctors, you must know the periods, you must know the cycles, you must know how to count the days, because that'll be able to assist both for the man and the woman to be able to know when can I conceive, when the right person, when the right time for us to be able to conceive. And then normally when we start doing investigation, mainly for the infertility, there are different tests for men and there are different tests for women. And then when we start, we normally like to do all the tests at the same time. And that's why in most cases, my advice is that when you are got infertility issue, you need to cooperate, both of you, both the man and the woman, so that can be checked, and so that can know who is the problem and who can be advised to be able to check what it is. Normally, when people have got infertility, we normally advise them what can be able to do, and there are some many tests we can be able to do to confirm if somebody have got infertility. And when we do, we normally tell you what is the issue is. The most common test to check if the hormones are blocked, if their tubes are blocked. If their tubes are blocked, and the other one we check if their hormones are normal, both for men and women. Once we do that, we'll be able to advise you what we can be able to do. Infertility is a major problem, which actually I've seen so many patients, and we can always advise. The other thing which is very important, and I normally tell people, is that the first thing when you've got issue in infertility, first check your weight. It's very important to be able to control your weight, because weight can be a contributing factor apart from the other factors you have talked about. So weight is a major issue when it comes to infertility. Mainly for women, weight can be a contributing factor. So if you need to reduce your weight to see if your hormones can be back to normal, and if you can be able to conceive, if you reduce that, your weight. If you got blocked tubes, we normally advise people to go for operation to do a test called tuboplasty, when the test which actually the major aim of that test is actually to open the tubes, or if you've got fibroids, to remove the fibroids, so that can be able to conceive. So once you have got a problem about infertility, you can always consider what you need to do, and depending on the advice of the doctor. And what's very important is that we normally give, when you've got issues of hormone, we have got issues of libido, especially for men, we can be able to assist. There are some products which you normally give, and they assist a lot. Even for women, when you've got infertile, when you've got infertile, or you've got over which is not being produced well, or you're not having periods, or you're having periods for a long time, or your periods are not regular, there's what we can give. There's a product which is natural, we can be able to give, and then after some time, your periods become regular, and you can be able to conceive. Remember, one of the causes of secondary infertility in women is that when you have used contraceptives, the contraceptives normally they are supposed to stop you from conceiving, and even when you stop using the contraceptives, the hormones are still imbalanced. And women actually, when you have used contraceptives, actually find that when you want to conceive later, even if you stop, you may take a long time, or you may never even be able to conceive, because remember, the fertility of women are controlled by hormones. Once your hormones are not in order, once your hormones are being disarranged, or once your hormones are being affected by another hormone, it means that actually you're going to be able to conceive. So when you are infertile and you used a contraceptive before, what's very important to make sure that at least you detoxify yourself, you take time to clean your body, to clean your hormones, and that's normally very important for women who actually, they either used contraceptive before the first delivery, or they used contraceptive after the delivery, and they find that they cannot be able to conceive another child. So, and that's what actually one of the common causes of secondary infertility, use of contraceptives. And then there's issue of men, which is a libido. When men are low libido, it becomes very difficult to be able to conceive, and the men who actually cannot be able to function, and those men need to be assisted, because if man cannot be able to function, cannot be able to fertilize, and normally we need. That's why in infertility, we do check to know exactly what's happening, and that's why infertility it is quite deep topic, and needs to be looked quite carefully, because it causes a lot of financial strain, It causes a lot of social disturbance, especially in family life. Especially, we know that African life is that a woman is seen as having a child, and any woman who does not have a child, he has always seen in a different way in African setting, which actually it can be very disturbing, especially in the rural areas. And even in urban areas, in fact, we expect when you are married to be able to conceive, to be able to have a baby. And when you cannot have that, actually becomes quite difficult. And sometimes, and this is quite very important, is but that actually for women, their time is limited. And that's why you find that for a woman, when we are around 40 years, 45 years, 50 years, you may not be able to conceive. Conceiving becomes quite difficult. And that's why when you're a woman and you find that you are reaching 25 years, 35 years or 40 years, and you have not had one conceived, it's good to start doing it early enough. Because I know, and this is quite a fact, is that most of the ladies nowadays, by the time you're 40, 45 years, they stop having periods and you cannot be able to conceive without having monthly periods every month for ladies. And you find that actually once especially common ladies who have used contraceptives, after they dry up, they don't actually have monthly periods. Once you stop having monthly periods, it means that your hormones are not in order, and it becomes very difficult to be able to conceive, because it's the monthly period which regulates the production of the ovum from the ovary. And once it is deranged, it becomes very difficult to be able to conceive. And that's why for women, you need to be in a hurry, especially when you reach 35, 40 years. It's not very easy to conceive at that age. Before, women used to conceive until they're 55, but nowadays you find that actually most women can stop at 35, even for 45 years they cannot be able to conceive. Now, for men, of course, we know that men are fertile until very late. If even 80 years, 85 years, man can be able to conceive or can be able to fertilize. So for men, it is quite different. The only disadvantage for men in fertility that it's not easily solved, because especially for men who have got issues of the sperm count, of issues of morphology of the sperm, becomes quite difficult to be able to control. But mostly, there's always something that can be done. When you've got this issue, you just consult your doctor and be able to direct you exactly what you can be able to do. So normally, very important to make sure that at least for those who have got issues of primary or secondary infertility, both in men and women, always you can be able to assist you and show you exactly what you can be able to do. My name is Dr. Geoffrey Mutuma from the Zambezi Hospital, which is in South Sea, and then my number is 0722-801-299, and the other number is 0734-801-299. And to find that actually we are available, we can be able to assist you. And of course, we don't specialize in fertility ourselves, but can be able to advise you what to do and can be able to direct you which are the right doctor to be able to see and be able to guide you. Normally for us, we specialize in cancer awareness and cancer screening and also cancer treatment. That's our specialty in the hospital, and even in Cambridge where I work, where I focus mainly on cancer research. So it's normally very important to make sure that at least when you've got issues, follow us in our YouTube, in our social media channels, be able to advise you. When you need to have a question, you can always get my number, and we'll be able to call you so that I can be able to advise you. For those who want to be done cancer screening, nowadays we are doing what we call workplace health promotion, where we are talking to people about cancers at their workplace, at their villages, at their churches. So once you need to be at your group or at your family level, we'll be able to come and talk to you. We'll be able to advise you what you need to do. And our major thing and our main goal ourselves is actually to create awareness of cancer by doing cancer walks, which we do them in October and we do them in February. And this October, this year, we are doing it in Meru. We are doing it in Meru. We are doing it on 30th of September. Makueni, we are doing it on 7th of October, and Kwale, we are doing 14th of October. And if you want to join us, kindly come and join us. Let us create awareness about cancer. In February, we'll do the cancer walk in 7 counties. We'll do in Nairobi, we'll do in Kiambu, that's in Thika, we'll do in Machakos, we'll do in Mombasa, we'll do in Embu, we'll repeat in Kwale again, and we do in Meru again, we do Makueni again. Those are 8 counties. We do it in February, on 24th of February, because we normally do our cancer walk in February. And that's why it's very important for us, at least when you join us, to be able to know when we do it. And of course, our main aim is to create awareness to cancer and be able to screen people and detect cancer early, so that people can be treated for their cancer very early, which the cure rate is normally quite good and quite easy to get cured when you're stage 1, stage 2. When you're stage 4, as we have talked about in another episode, is that is normally not very easy. Asante sana, thank you very much.